Migraine. You are obviously listening to this because you would have, at some point of time in your life, experienced a migraine attack. Migraine usually starts off as a mild, nagging headache, usually on one side or in some people on both the sides. As the day progresses, the headache increases in intensity till it becomes a pounding, throbbing, splitting headache so severe that you feel your head may burst. As the headache peaks, you start feeling nauseous and you just wish that you could vomit. You don't want any light falling on your eyes, so you draw the curtains and stay in a dark room. You don't want any sounds, as every sound will increase your headache. You become very irritable. You don't want to talk to anyone, so you prefer to shut yourself in a dark room. Usually, these headaches may start in one eye and go up and settle down in the back of the head, or it could start in the back of the head and settle down in one or both the eyes. It could be a complete or a partial headache. Some people also experience blurring of the vision before or during an attack. Many women suffer with a migraine attack before or during the periods every month. Most of the people with a migraine attack feel better after vomiting or after passing stools. Now, these are the typical ways a migraine can present itself. Most migraines have triggers that cause these attacks, and these triggers are physical and emotional. Physical triggers are very few, like being out in the sun for too long or doing unusual physical activity on a day, and then you end up having a headache. Most of the time, the triggers are emotional, like you have a fight with your spouse, you have arguments in the office, you're upset about something, you're disappointed about something, you're excited about something. All these can trigger of a migraine attack. Not eating on time is again a trigger, but I put it in an emotional trigger because usually the reason you're not eating on time is because you're busy doing some stressful work, or you're upset that you don't feel like, or you don't have the time to eat. Overeating and over drinking can also trigger of a migraine. This also I put it as emotional because you're either celebrating something or you're drowning your sorrows because of some issue. Now, most of the migraine attacks are triggered by an emotional trigger. When you approach a doctor for migraine, he will give you some medicines and you will feel better. The intensity of the attacks will get better, but in most people, it does not go away. And the reason is because only the effect, that is the migraine, is treated. But the trigger factor or the cause that is emotional is not considered for treatment. And that is why a migraine can only be controlled but not cured. This is where homeopathy comes into play. Homeopathy is probably the only system of medicine which treats the mind, emotions, anxiety, and stress. So, when you treat a migraine with a combination of homeopathy and allopathy, homeopathy takes care of the cause and allopathy takes care of the effect. This will help not only to control the migraine, but there are chances that you may even be cured of it. Once you start on this combined treatment, as your migraine attacks get better, you can slowly taper off your allopathic medication. In the past 33 years, we have had more than 5,000 patient visits for migraine to our clinic, and we've been able to help most of them. I have experienced migraine attacks myself, and I know how painful they are. I recommend you begin your treatment of a migraine with a combination of allopathy and homeopathy. As you begin to feel better, you taper off the allopathic medications and later use them only as an SOS, only when it is needed. Once you start on the homeopathic medication, I have seen that the intensity and the frequency of migraine attacks will come down over a period of time, and eventually the attacks will. I have already told you that one of the best ways to take care of your migraine is to take a combination of homeopathy and allopathy. Let me share with you other ways that you can help yourself. Number 1, eat wisely and eat in moderation. Never overeat. Number 2, drink plenty of water. Our body is over 70% water. The water balance in the body has to be maintained. So you have to drink plenty of water whether you like it or not. Number 3, get abundance of sunlight. Sunlight is very, very important for our existence. The heat in the body comes from the sunlight. Sunlight has many other benefits too. So get abundance of sunlight. Number 4, very important, pranayama or breathing exercises. Now, the reason you do pranayama is because on a regular basis, we go through multiple emotions. Emotions of anger, emotions of jealousy, emotions of sadness. Have you noticed that every time you go through an emotion, your breathing also changes? It is very important to correct your breathing. So, that correction of the breathing can be done by doing pranayama for a few minutes every day. If you can follow these with a combination of homeopathy and allopathy, your migraine will not only be in control, but you could get rid of them forever. Take care.